It's me. Yeah, Bob Marley. Nestor Marley, I'll tell you something about him, but I'm gonna give you a little medley, one drop. Yeah, that's one drop. You know, Bob was born, as a matter of fact, when was he born, actually? He died in 1981. I think I remember that a little later. Died 36 years old. However, what is this gentleman believed in the Rastafarian type of religion, and you know, he's born February 6th. I know he was Aquarius, but you could work the numbers back. I'm on air right now. I'm live. I can't work no numbers back. He's 36 years old. He died in 1981, May 11th. Then as you work that out, you give it to me a little later. Yeah, so guys, but what I do recall about Bob, he's my icon, I gotta say that. And I really, but belief is something. If you believe in something, what is wrong? What is right? Who knows? Everybody always try to judge each other. No. You know, what's right today was probably wrong yesterday, and what's wrong yesterday is probably right today. I remember 25 years ago or 30 years ago in school, Procardia was a drug. You come in with chest pain into the emergency room, you put it on the tongue, and those people, at that time, it was the right thing to do to save their lives. And if they ask you in the exam, what's the first thing you do? Someone come with unstable angina or pain in their chest. You say, you put a sublingual Procardia, it's called a calcium channel blocker, short acting actually, under the tongue, and that's right. But it found out later on that a couple of years later that it killed people. So what we did, we killed a lot of people to learn that it was wrong. Now it's nitroglycerin under the tongue, okay guys? So people have different beliefs, and you have to respect them. Don't try to push your belief in them. Maybe you could try to explain and in a nice dialogue with them what you believe in. Maybe you'll convert them. But Bob believed in Leviticus 21:5. This is what it says. They shall not make baldness upon their head, neither shall they shave off the corner of their beard, nor make any cutting, actually, in the flesh. He believed in that. And that is why Bob had melanoma of the toe. And you know what? He felt that he shouldn't cut it. And melanoma in the toe normally doesn't kill people. You take the toe out. That's it. Amputation. End of story. But then you look back and you say, maybe if Bob didn't believe in that, he would have had the amputation done, and he would have been alive today. And then you said, but then maybe if he didn't believe in what he believed in, would he have been famous? Would he have been so conscious in his lyrics? All of those things, who knows? Rat Race. I'll be right back. Yeah, that was Rat Race, man. This is really a rat race here. Life in itself is a rat race. I can sit down and listen to his songs every day. It doesn't get, it doesn't bother me. I can say it sounds the same or a little sweeter. And sometimes I wonder if it's just the music or if it's just the lyrics. I think it's a mixture of both. But then, I used to be very good at numbers. I must be getting older, because I can't believe I didn't remember, but you helped me. Thank you. He was born on the 6th of February, 1945, and died May 11th, 1981. Metastatic melanoma cancer in that toe, and it went to the entire body, and that's how he, at the age of 36, man, it's kind of young, gone too soon. We're going to talk about diabetes today, and I got Paul in the studio. I'm going to juice you to him in a couple of minutes. It's 9:09 in the morning in VOB, and you're here with the doc on the rock, on the island where life begins and ends. I want to say thank you to one of my listeners, Jennifer Clark. She wrote me a nice letter, and she loved the show. Thank you, Jennifer, for listening. And she commented on the fish that I talked about. and how you prepare the fish and to prevent it, to get the rankness out of it. So I'm gonna try it, Jennifer. And I have a Cheryl and a few other people who told me about ways to get around this thing. And I'm going to try it this week. I had the fish bought yesterday. And then next week I'll give you a follow-up. I'm going to cook that myself. So, that was, and all you listeners out there, I want to thank you for listening. Turn your radio up and call your friends and let them know the doc is on. And, I'm on. I always give you food. And I promise to give you 30 years longer. Can't give you life, only the Lord, but I can help you to extend that lifespan. And that's what we're about. I told you I want to live forever, and one day you'll understand what I mean when I say that. But stay close to the plant, and it's a good way. We have Paul in the studio, but diabetes, let's talk about Professor Henry Fraser and Professor Hennis. Those guys did some study. We have some good professors here on the island. As a matter of fact, I got to tell you about something, even before I give you some numbers. We are considered the amputation capital of the world, so... in the Caribbean, at least. That's crazy, isn't it? And I'll tell you what happened, because we're not set up for people who are handicapped, or roads, or bus, everything, not set up for them. The mental factor comes in, and a lot of our people just give up. They give up, and not to mention the people who tease them and so forth. So we'll talk about all of those things. All of these things I can't compress into 1.5 an hour. I got Paul in the studio. I'm going to talk to him a few minutes. But I got a patient who came in to me this week, actually, and I had to do a procedure on him, and he really came in real bad. And then I'm there. He was out of it completely until, a couple of days ago, I went and I saw him, and I said, well, you went to hell and back. He says, he laughed. I says, you remember there's a movie, Audie Murphy, man, to hell and back. Those guys used to act real well, And he was laughing, man. We're talking about, I says, man, listen, you came back here to do something, so go and do it. And life is funny. Guys, the most valuable asset you have is your health, okay? Yeah, you think you got a problem? You hit the car this morning. Yes, it looked bad. And then you're depressed and you're worried. What's the matter with you? All right, you come home when your wife is gone. Take the furniture in the empty house. Yes, problematic. Yes, you got horn or whatever. Those are problems, right? Yes, you had a little problem with a neighbor. And whatever happened, you curse out or whatever. And you're depressed over those things. You come home and there's no food. You got to worry with boil a little rice and put a little bit of butter in there. But that's only for today. Maybe a week from now it wouldn't be like that. So those are problems that are transient. How about if you're driving to work and you meet an accident and you lose both legs? Now you got problems, right? All right, what about that? That's why I always say to you, look at your neighbor. When you think you have a problem with your neighbor, and who's your neighbor? Yeah, anybody. They even have a bigger one. Cancer. I actually am talking to you today, guys, at lab, but, I actually had a patient once who came to me with breast cancer, and I said to her, don't speak to me again if you don't take this breast off. She was angry and she went away and as a matter of fact, she called me about a few months thereafter. I was angry that I said that to her. You know why I said that? I said that because I've seen too many people go out there and take a piece of the lump out. And then they come back 3 years later and the cancer spread all over their body and they're gone. Listen, I can't tell you how many women I met like that. Because they want to have that contour of the breast remained there. They took a piece out. Listen, cancer doesn't belong in your body. Take the whole margin out. We're soon going to be having some plastic surgeons from Beverly Hills in town to do some work, so maybe that'll help the whole picture. Paul, good morning.
Good morning.
It's good to have you here with us today, and I know you're not nervous, but you're quiet in the corner there, and I know you had a life, and I want to talk to you about your life there, now, and the future. So before I say hi to the nation.
Hi, nation.
There you go. Love it. So let me give you some statistics, actually, before I go down into that. We spend diabetes and hypertension, these non-communicable diseases. We spend $58 million, $58.2 million on the total cost for diabetes and per year. And actually, that does not even include hospitalization and doctor visits and clinic visits and morbidity, which is ailment continual. And hypertension, we do 60.2 actually. No, as a matter of fact, 120.4 million. That was 60.2 million US, but I'm talking about Beijing now. $120 million dollars per year, and that doesn't include hospitalization, clinic visits, and so forth. And that's a lot of money, a lot of revenue going into these disease entity. And Dr. Fraser, or Professor Fraser actually, and Professor Hennis did studies, and they show, they concluded that Barbados, the diabetes in Barbados and lower extremity amputation are among the highest in the world. They said inadequate footwear independently triple amputation risk. So education of professionals and patients, particularly about footwear and foot care, coupled with improved diabetes clinical care, is key to reducing amputation risk in this country, in this population. And they did other studies. We must say thanks to Professor Fraser and Hennis. They do a lot of studies, and I'll tell you right now, studies what builds a nation and make a nation healthier. They concluded that mortality rates here in the Caribbean is the highest reported worldwide because of the diabetes. So interventions to limit sepsis and complication from cardiac disease offer a huge potential for improving amputations in this vulnerable group, diabetics. Before I come back and talk to Paul, it's 9:16.5 Saturday morning. You're there with your little coffee and your bakes and saltfish. I hope you took the salt out of that, because, you know, salt and pressure goes together. Jaliv, Bob Marley, and then I'll come back and we talk to Paul. Yeah, that's Jaliv by Bob Marley. So, diabetes type 1 and type 2. So, the most common cause of amputation of the lower extremities is diabetes. And most times diabetes like to bring some brothers with it. High blood pressure and high cholesterol, they're like three lovers. They like to hang out together. So, and when you have diabetes, you got a lot of problems with neuropathy and retinopathy and cardiac problems and blood flow problems. And all these things, these composite factors, cause you to have decreased blood flow to your leg, and you have healing problems, and then, you know, the next thing you know, you have bone infection, and then there you go, actually. The toe is going, or the feet, and that's minor, and major would be below the knee or above the knee. So Paul is here with us today. Paul, tell us about what's your first interaction with diabetes?
My first interaction with diabetes is that I was born with diabetes. My mother conceived that she had me first, and then I had a brother and a sister died from diabetes.
What age did I know?
Well, one is about, between us, he's only just about a few months in between. I is September, he's March.
Oh, okay.
So,
so
when my mother was young, she was diagnosed by at the old hospital, not a new one, that she was a diabetic from the time she was a youth.
Oh, okay.
And when she got married to my father, I inherited from her, and then my brother and my sister, only sister I had, they get the diabetes too. But I'm trying to cope with the diabetes, because I will tell you that I was looking for amputation on the foot, but when the doctor told me that I had to lose the toes, and I lost the toes, and I thought that
everything. Let me just go back a little bit. So it means you were born with diabetes.
Yeah.
So all you knew is a needle and sticking yourself every day.
Yeah.
That's all you know about.
Yes.
You were very slim. You were very slim when you were born.
Yes,
right?
yes. I am the we are called. I'm not. So, my weight is. I try to control my weight because with diabetes, you can go into a cardiac arrest or anything like that.
I know.
But if you do the right things, take your medication, take your insulin and what's not, you can survive for a long time.
So you used to really take care. Who helped you? I mean, was it family support or was it because?
Well, after my mother died, it was hectic. I was on what you call. I was lucky though, because what happened is that when the doctors tell me that one of my toes started to get bad, I took out the big toe first, then took out the middle toe, and the last three went to the gangrene. And the last one was gangrene, and it was coming up to the heart. But all of the x-rays that I had were negative. It comes up EKG after you get your blood test, you get your blood this and that day, and you can live with diabetes if once you do the right things, because you don't have to push yourself. That if doctors tell you to use insulin twice a day, you use it twice a day, early on mornings and late at night, and you try to make exercises. And at first I was hectic about getting the amputation, but I keep telling doctors, man, I don't think that I can need amputation. But when they tell me that it's hereditary and all kind of thing, I said, well, if you all say so, you are the doctors. So I follow the
advice.
The advice.
So you at what age did you have the first amputation? How old were you then?
Well, I was in my teens. I didn't marry yet. I was married in 1983.
Okay.
A wonderful girl that come from Guyana. I used to work with the uncle driving the ice cream van, the Goldilocks van, and I used to drive the Sadar, the bus, you name it, I drove it.
Oh, okay.
And I was in hospital for 6 months. No, 6 weeks, plus 6 weeks of a month, of a year, you know. And they came out on August the 16th, and then they had me in the hospital, trusting my foot when they take off the foot, and I signed the white paper and I said, take it out, because I heard Professor Mickey Waldron said one time on a program that people with diabetes can live long. Diabetes can live long and they can inherit a good life, but they must follow the rules of the doctors.
Right.
You see, some of us don't like to listen to what the doctors say. We want to do a lot of things, and when down we find out we get obesity, we get too fat, and your heart. But thank God that the heart did not collect the information. There was information in those.
Yeah.
And they had bones to cut out, and if we went so far, I cut 2 arteries on my foot.
Oh boy. So let me ask you a question. So you had this amputation, and then they went to the part where the below the knee amputation. When was that done?
That was done on the
what year? Just tell me the year.
Last year, 2012.
Good. So 2012. What was it like living before? At least you had your 2 feet and you were able to move around with cane or whatever. Now you have you just have one
foot.
So what's the story? How is it like? How people are treating you? What's it like to get around in this country like that? Is it depressing?
What happens is, wherever I go, I just hear people talk, but it doesn't bother me to talk. Because
I mean, what did they say? You hear people say negative things?
Look, he was so young, look how he ended up. I tell a friend of mine at school one day that, but I wasn't diagnosed with diabetic yet. I used to do play a lot of games, cricket, thing, you name it. But I go to the Garrison on the Saturday and to races, and I enjoy myself. And so I walk on the Garrison in the morning, and then I was hospitalized for about 6 weeks. And in the 6 weeks time, my feet came out. The right foot came out. Because the gangrene was spreading from one knee.
Yeah.
And I I can tell you something. Maybe get a punch for a glass bottle only. That there is very easy to. I even feel it.
You didn't even feel it.
I didn't feel it. I went along my normal way as a man. It can blow over. And then in a week's time, I saw between my right foot, my toes, a little sort of like a flower coming up. And when I went to A&E, Dr. Peters diagnosed me as I'm a diabetic, and I have inflammation in the foot. Well, the inflammation spread till it went to I take it to the big foot out, the small toes. I was in hospital before the month in front, July.
Yeah.
I spent a couple of weeks there. That time I had only foot. And so Dr. Ferdinand was telling me that if I don't make a decision quick to get the foot out, it would cause me to go into, cardiac arrest or heart attack.
Gotcha.
And when I was going to the surgery, I was given 3 bags of blood, but 2 in the ward and 1 after the.
You know, your story. We need to come back. So I'm gonna invite you back, probably not next week, because next week we're gonna have Paul. We're gonna have a professor. Professor. God, he's gonna get me. We have doctor. He's endocrinologist, someone who studies all of the endocrine glands and the hormones and so forth. I know him personally, Dr. Goddard. He's an extremely good physician, endocrinologist, and also an internal medicine specialist. He can listen. This guy, anyway. He'll be here next week to answer your questions and to talk to you a little bit about diabetes and so forth. And then I'll bring Paul back after. We'll talk about what life is like with living with this amputation in this country and in the region. It's not easy. So I want to thank you guys for listening. And Paul, thank you for coming. I'm going to have you back, not this week, not next week, the week following. Next week it's going to be Dr. Goddard. He'll talk about diabetes and the various ways how you can foot care and so forth to prevent yourself from having amputation. But Paul is a living example. If you live well and you follow the doctor's advice, he was type 1, born needing destructive pancreas, needing insulin from day one. And look at him right now in his later years, and he's here living. A lot of people would have been gone by now. And he's living with 1 leg. I want to thank you for coming, Paul, and we'll see you back when you come back. And I must say, thank you all for listening. I'll see you guys next week.